Hello, everyone. So this is the second module in my Introduction to Qualitative Research Methods. My name is Priscilla Magrath, and I teach the course HPS 607, Qualitative Research Methods in Public Health at the Mel and Enid Zuckerman College of Public Health at the University of Arizona. And in this second module, we are going to be talking about sampling and data collection. So let's get started. First of all, sampling. Very, very important for the credibility of your research. And sometimes, if not enough attention is paid to sampling, then it will give qualitative research a bad name, and we don't want that. So let's return. In module 1, I did talk about validity, meaning how close is your data to the reality, the truth. And we distinguished internal validity, which is, can we believe the data? And external validity, can we generalize from our data? So sampling is all about external validity. What can I say about my results that may apply to a broader population? So very broadly, there are two types of sampling, and this is going to cut across qualitative and quantitative. There are two types of sampling: random sampling, where each unit of analysis has an equal chance of selection. That is amenable to statistical analysis based on probability theory. And as I'm sure you're aware, this is kind of the gold standard for quantitative research: numbers, statistics, epidemiology, biostatistics. So then, if it's not a random sample, everything else is a non-probability sample. So in that case, purposive sampling driven by the research question and the intended analysis. So it's the non-probability sampling where we need to justify our approach and choose the right approach. So the first question is, do I need to estimate a parameter for a larger population, the incidence of a disease, for example? If the answer is yes, then I do need to use a random sample with the size determined by probability theory. But if this is not practical or ethical, then I try to approximate it. But there, the random sample is going to be the gold standard. However, if you don't need to estimate a parameter for a larger population, and we've been talking about qualitative research, the kind of question that we have if we want to know what do people think about a particular health policy, or we want to understand what is going on in a hospital, or what do nurses mean by care, you might not need to generalize to a broader population. It's still interesting. You've gained a lot, you've understood a lot without. So at the end of the day, which one is better? So a researcher called Guest, in an article in 2006, he argues that a random sample should be used if possible, even if it's qualitative research, because it will strengthen your results. But Russell Bernard, in his textbook of research methods for anthropology, he says in many cases a random sample is not needed and it's more expensive. So he says even for quantitative, don't use a random sample if you don't have to, because it's going to be more expensive. So I invite you to think about your field of research and whether random sample is necessary. Now, let's move on to focus on the non-probability sampling. And here we've mentioned purposive, which means there's a purpose and you're choosing people, but there are different types here. So a quota will use a grid. So you'd have specific, so if you want to look at something where gender or age or health status, for example, is important, you might want to make sure, or ethnic category, ethnic identity, You might want to make sure that you have enough in each category. Otherwise, you won't be able to say very much if you only end up with 1 woman and 20 men, or no people who are non-binary or something like that. So you want to make sure you cover the range. Okay, so that's a quota. Purposive, you develop certain criteria. So you want to understand women's experience of reproductive health. Then you might want to choose women of reproductive age. You might want to include people who are pregnant or have had children or so on. So, or it may be determined by the theory or the research question. So if you're particularly interested in the impact of a policy on the poor, then you want to target the poor, for example. So it's a kind of a targeting. So then you might just be doing exploratory research and you want to know what do people think of the new COVID vaccine or something. So then maybe you don't have many resources. It's just whoever you happen to meet, or maybe you'll go to a vaccination clinic or something and talk to people. So that's a convenient sample, which the validity is not going to be as strong. And then there's network sampling. Now, if you have a hard to reach population, you might identify somebody who's HIV positive and then ask them if they know somebody else who might want to be included in the study, that snowball. Or you could just leave it to the respondent to identify other respondents. Okay, so that's just a very broad overview. So the real question, as always, alignment. Find a good match for your research goal and analysis. So a quota is going to be more systematic and may have stronger validity with some audiences because you've got that balance. You've covered all the different groups. Purposive is best for hard to reach small population or where there's no population list from which you can take a random sample. So a hard to reach small population, an example might be people with a certain mental illness or something like that that's not evident unless you actually have some way of accessing that population. So convenience is sort of the last resort if nothing else is feasible. And the network is useful if you don't know where your population is or how to access them. So when we've got this purposive sample where your criteria is determined by theory or the research question, that can be broken down into different options as well. And I'm taking Michael Patton as my source here from the textbook Qualitative Research and Evaluation Methods. He has a very comprehensive sort of list explanation of all the different types. So you might be interested in, if you can think of a particular phenomenon that has a range of expressions, okay? So are you interested in the extreme cases or deviant cases? For example, let's say you were in an area where the incidence of hand washing is very low. You might want to go to households where people do wash their hands. That would be positive deviance, in order to find out what are the facilitating factors in that case. So quite often, if we're doing exploratory research, we're interested in the maximum variation because we want to cover the whole range. We want to get the whole picture. So that's quite a common one. You might want to take a purposive sample of a very homogeneous group for a focus group, and we'll talk about that later, why you might want to do that. You might want to find a typical case. How is this policy being implemented? We just want a typical case. We're not really interested in the extremes or the range. Or you might have some critical case that you're interested in. For example, you've heard, a story about a hospital that was a government hospital and it was taken over by the private sector or something like that. Okay, why? How did that process happen? What were the particular considerations. Unlikely that you'll be able to generalize from one case, but you'll learn a lot about that critical case and what went wrong or what went right or whatever it is. So then we have criterion base. You may be interested in all cases that meet the particular criteria. Every hospital that was taken over by the private sector. Or theory based, meaning that the cases are predicted by the theory. So that depends on the theory. So I'm going to give a little example here from IUWASH plus Water, Sanitation and Hygiene project, where we did mixed methods. We took a purposive sample of cities, meaning we chose the cities that were included in the project, which was a water, sanitation and hygiene project. And then we took a stratified sample of households from the bottom two socioeconomic quintiles in each city. So that was a purposive as well. We were only interested in the bottom 40% in the poverty range. Then we took a quota sample of households for case studies, making sure that we had fulfilling these particular criteria: no toilet, no running water, toilet, running water, and so on, all the different categories. And then we also took a quota sample for the focus groups to make sure we had enough men, women, people with toilet, people without toilet. So you can combine different ones. That's the main point. Okay. The next question that often comes up when you're designing a research study, let's say you've decided you're going to do a purposive or your quota or whatever. Well, how many cases? And the tendency is to overestimate or to think you need more cases than you actually need. Now, again, it depends on your research question and what you're trying to do. But there's this term saturation that is used a lot. And when you're writing up your research, you'll need to make a comment about it. But there are two types. There's thematic saturation, meaning keep collecting the data until no new themes emerge. So, for example, where the little project we're doing in class, where we want to know how students use the library. So we just carry on visiting the library, talking to students, and then we find that they all start saying, we start getting repetition. We're not getting anything new. We're not getting any new themes, okay? So then we can say, okay, we've reached thematic saturation. But there's also theoretical saturation. So that means you keep collecting data until no new issues emerge related to the theory. So maybe you started out with a theory, health behavior model or something like that. Okay, so then you find that, or the socio-ecological model, whatever the model, you keep collecting data until you've kind of saturated from the point of view of that model. Then there's also theoretical saturation in the sense that you may be generating theory from your data. So that is an approach called grounded theory, which is inductive, which we'll talk about in another module as well, meaning you don't start out with a theory, but you look at your data, you listen to your data, and you start constructing a theory based on that. And then you have to keep collecting data every time something new comes until you feel you have a robust theory and you don't need to collect anymore. So some scholars decided to test, to develop an evidence-based approach and to test how many interviews do you actually need before you stop getting new themes. So very interesting. This is a kind of a classic in the qualitative research literature. And they had 30 interviews with sex workers in Ghana and 30 in Nigeria on perceptions of HIV research. So you've got two different countries. So you'd think there might be quite a lot of variation. They analyzed the emergence of new themes in successive batches of 6 interviews. So they take 6 interviews and analyze all the themes, and then they take another 6 interviews and analyze the themes and see if anything new came up. So they actually did this as a kind of a lab experiment, I suppose, to see how many interviews. And they found that 12 interviews was enough for identifying themes, and 6 interviews for meta themes. That means sort of overarching themes. 6 interviews was enough, which is probably less than you might think. I mean, that means you've used a lot more resources to do 60 interviews, and after 12, nothing new came up. So that has generated a lot of discussion, and you know, people may have different views. Then 10 years later, in 2016, they Guest and another group did another study where they did a similar thing for focus groups. And they found that 80% of themes came from the first 3 and 90% from 6. So you can see there's sort of diminishing returns here. But it's interesting that if you only do 3 focus groups, you would still get, in this case, 80%. However, a lot of people have commented, well, it depends on your population. It depends on your research question. So let's have a look at some factors. You would need a larger sample if the population is very heterogeneous, if you're comparing across multiple sites or subgroups, and if your data is more superficial. What do I mean by that? Well, if you're doing very in-depth, rich interviews, then you wouldn't need so many interviews to generate your themes than if you had more superficial. More superficial means you need to do more interviews just to make sure you're getting everything. And then if it's a large scale project, like the IU Wash Plus was quite a large scale, and you've got a larger budget, then you probably need a larger sample. So let's move on now to data collection. So I'm going to address 3 different data collection, and there are more, but I'm going to focus on observation, interviews, and focus groups. So let's start with observation. Now, when would you use an observational study? Well, mainly if you're interested in data on what people do, not just what they say they do. Because remember that if you're doing interviews and focus groups, all you're getting is a report. And maybe that's what you want. Maybe you're not interested in the phenomena. You're interested in what people think about the phenomena. But if you want to know, do people wash their hands? Then there's really no substitute for observation. Sorry about that. You just got to go and watch people. Otherwise, you're not really going to know whether they do that or not, because it's not just that people might lie or forget to tell you. There are many reasons why you may not get accurate information from an interview. Because did you know that 45% of human behavior is habitual? We don't even notice we're doing it. So that is why observation is very, very important. And some people have said, well, that's the gold standard. You can't beat observation. But imagine if you're observing a situation, you want to observe some health practice or other, and you're not familiar with the context or the population, then observation is going to be open to misinterpretation as well. You're going to be thinking, well, what on earth is going on here? I don't understand just from watching. So although observation is very good for studying practices, behaviors, encounters, the observer may want to participate to varying degrees. And there's a whole spectrum from just observing, which you could do for photographs or videos. Okay, you're not participating at all. And then you can imagine different degrees of participation until right at the other end, you're a complete participant. So for the library study, you know, students studying what students do in the library, well, you could just go and use the library as a participant while studying other people using the library, okay? And you're probably not going to raise a lot of suspicion because you're a student using the library. So you have to decide, based on your research, where you want to be on that spectrum from observation to participation. But there's sort of another parameter, which is if I'm a student and I'm going to study in the library, and I'm also watching other people studying in the library, what if I see something that I really don't understand? You know, I might want to go and actually talk to that person and find out what they're doing. So that's the other sort of dimension of observation that is often combined with informal interviews, which we'll come to in a minute, because you need to make sense of what's going on. Otherwise, you might not understand it. So then ethnography is the sort of key word. Ethnography just is in-depth immersion research with the goal of understanding social life in context. And again, to do an ethnography, most people would agree, although the definition varies a little bit from one discipline to another, most people agree you have to be there in order to claim that you did an ethnography. You have to be there, observe, talk to people, whatever. Long-term participation in a field site, well, these days it's not always very long-term, but at least you have to go there, immerse yourself. Could be a hospital ethnography, could be a week, something like that, up to a year, 2 years. So when you're doing an ethnography, participant observation is often the key approach, but that's combined with interviews, focus groups, surveys, etc. So what about interviews then? Let's move on to interviews. When would you want to use interviews? Well, some examples of when you'd want to use interviews would be if you're interested in people's experiences or interpretations, but particularly you're interested in this person's experiences or interpretations, and you're going to ask them probably to talk about themselves, individual accounts and perspectives. What do they think about the new vaccine? Or what do they think about water resources in their neighborhood? So then each person will have their own response, and that will generate a range of different responses. So that would be one way, but there are different types of interviews. So let's have a look at some of these. Well, what would be an informal conversational interview? That would be the kind that you might do while participant observing. So, you know, you're in the library, somebody does something you think is a bit puzzling, and so you try and find out what's going on, or you're in the marketplace and there's a noise or something happens, and then you sort of want to find out, you want to talk to people, find out, well, what's going on here? This is something I don't understand. So informal conversational interview is often done while doing something, or, you know, you might join farmers in the field while they're harvesting. Okay, and then you can interview them, ask them what they're doing while they're doing it. Then we have the unstructured interview, which is basically you might have one open-ended question, you know, what do you think about such and such? And then you just let them tell their story. Or, you know, I understand that you have been through treatment for cancer, you know, what was your experience? And you just let them tell their story. Occasionally you might have some prompts, but each one is going to be different. They're going to take different story. And sometimes you will find, you know, a book or whatever, it's just one person, one individual history or something. Then we have the semi-structured, which are very common in public health, and that enables comparison across cases because although your questions are a bit flexible, you're basically asking the same questions from each person. And this is especially helpful if you have more than one person doing the interviews. Just make sure you're all on the same page. Then we have structured interviews, which are more usual for quantitative or confirmatory research, as we talked about in the first module, where you know what you want to ask, and you're not going to give the respondent a lot of scope for going off at tangents and so on. Maybe you want to assess the incidence of something after you've done the exploratory research. And then we have key informant interviews. And a key informant really is somebody who has a broader perspective on the system. So you might, if you're interested in a particular disease or treatment, rather than talking to patients, you might talk to providers and they might be your key informant, or the other way around, depending on what you're doing. I'm not saying a patient couldn't be a key informant, but they would need to have access to information beyond their own case in order for it to be useful, to have a broader vision of the system. So it could be a patient activist, for example. So what other issues should we consider when planning interviews? Well, something that's not on this list, which I don't want to forget, is piloting. Always pilot, always try out your interview questions with people who are not part of your actual sample so that you can get feedback and make improvements. But anyway, these issues, the place of interview can make quite a big difference to how people respond. So when I was in Indonesia doing research about birthing choices, if I asked mothers at the health center, you know, where are you planning to give birth? They would say, oh, well, I'm going to give birth in the clinic, you know, or I have to give birth in the clinic, or, you know, the policy is to give birth in the clinic. But if you interview them in their home, then they might say, oh, well, you know, it depends how it goes. You know, if everything's going fine, maybe I'll just give birth at home. I'll see what my lay midwife thinks or something like that. This is drawing on my research in Indonesia. So the place of interview makes a big difference to how people respond. And then building rapport, which is a whole thing in itself, that, you know, start with an icebreaker, start with some chit chat, make sure people are comfortable, give people options. For example, ask them where and when they would prefer to talk to you, be transparent. Of course, if you're doing more community-based or participatory research, a lot of these issues would all be discussed, and maybe the research participants would make all of these decisions. You need to think about the length of the interview. You need to consider nonverbal cues, such as how do I interpret silence if somebody doesn't respond? How do I respond to what I perceive as a lie or an inconsistency between what they said at one time, what they said at another time? These are all issues to consider. Ethical issues of if you're dealing with sensitive subjects, how to respond if people become emotional, and so on. Many, many different issues. And all of them will vary with the cultural expectations. I mean, for example, in Indonesia, nobody is going to tell you, or particularly the Javanese, they are not going to tell you if they're getting bored and the interview's gone on too long. You are going to have to learn how to identify the cues from them that, okay, time to stop. They've got something else to move on to. Now, the phrasing of questions, the design of your questions is very, very important. And one of the leading things that you're probably aware of already is to avoid leading questions that contain the expected answer in the question. So if you want to know, if you're doing research about hand washing, again, I hope you're not getting bored of this example, but it is a good public health example. You know, if you ask people, do you wash hands with soap? Then, you know, everybody knows they're supposed to wash hands with soap. So they're probably going to say yes, because that's related to another phrase you're probably familiar with, which is desirability bias. They don't want to be seen to be somebody who doesn't wash their hands because that's dirty or primitive or something like that. So when people are in an interview, they are presenting themselves, and they want to present themselves in a good light. So they don't want to offend you. So if they start gauging what answer you want, they're going to give you that. Maybe. No, can't generalize, but anyway. Now, another thing is very common and not a good idea. You have to really be careful to avoid sneaking in two questions into one, because they're only going to answer one. I mean, maybe one person will answer, but I mean, if you're interviewing 20 people, I can be sure not everybody is going to answer both questions. So if it's something like, do you wash hands with soap? And what times of the day do you wash hands? Or do you wash hands with soap and when? I mean, those have to be separate questions broken down. Otherwise, they're not going to give you a full answer. Now, with qualitative research, we often prefer open questions rather than closed questions, because it gives your respondent the scope to tell it in their own way. So, an open question would be, tell us about what do you do in the library? And a closed question would be something like, do you ever work on your assignments in the library? Okay, so they're going to say yes or no, but we've already put that idea in their head. And then they're going to start thinking, oh, I'm supposed to do my assignments in the library. So it's going to impact their responses. So, yeah, so recommended to use more open questions. And it's more fun. You get more unexpected answers for exploratory research. Then follow-up and clarification may be needed, even if it's an unstructured interview. You might want to say, could you explain that a bit more? Didn't quite understand. And then always good idea at the end to say, is there anything else you would like to add? And maybe they'll come up with things you would never have thought of asking. Okay, let's move on to the final topic, which is focus groups, which in my experience in international development and global health, when you say qualitative research, the first thing that comes to mind often is focus groups. So it's an important one to look at, but they're actually a lot trickier than you might think. So let's have a look at why. So the best time to use focus groups is if you want to identify what is going on in a group or a culture, group norms, attitudes, behaviors, things that you wouldn't get so much from an individual interview, but you can get it from the sort of to and fro discussion that you get. And then there's a bit of a debate about this. Some people say you shouldn't do sensitive topics in a focus group because it makes people uncomfortable. But other people say, well, actually, it allows you to deflect the focus from the individual because you can talk about it in a kind of a general way. Does anybody know anybody who doesn't have a toilet or something like that? So it enables you to approach those sensitive topics without stigmatizing an individual. So how to use, now this is really important. Basically, you can look at the term focus group discussion. So you need a focus for it to work really well. A picture, a scenario, a story. I've been doing research on water sanitation and hygiene, and we found some people use this kind of toilet, and you show a picture of it. Have you ever seen the toilet like that? Do you know anybody? Blah, blah, blah. So that gives a focus, and then everybody can speak. So group interaction is part of the data. So the data is co-constructed. So I said earlier that when somebody is in an interview, they're presenting themselves. Well, this group interaction gets much more complicated in a focus group because they're presenting themselves to the facilitator and to each other, okay? So we have to understand that may impact what they say, how they say it, and so on. So in qualitative research, everything is data. So what you want to avoid probably is treating it like a group interview. So if your questions are something like, what is your experience of using this new electric toothbrush or something like that, you want to avoid a question where every individual is going to have their own answer, okay? Because then somebody's going to respond, well, I use the electric toothbrush like this, and this is what I think. Everybody else has got to listen, and then you're going to go around, and if there are 10 people, it's going to get pretty boring by the end of it. So the question should not be directed towards individual experiences. As we said earlier, that's a good setting for doing an interview. Okay, sometimes it turns into a group interview, no matter what you do. Okay, then don't feel that it's a failure. You've still got good data. But what you really want is a situation where the facilitator could just throw out a question, let the conversation take off. I've been at focus groups where I actually went out of the room in order to enable people to feel relaxed. And then when the noise level goes up, I come in and see what's going on. So, so the idea or one of the advantages of a focus group is that you can explore differences of opinion. So that's another bit of advice, is don't feel that you have to reach a consensus, because then you're kind of forcing people you're kind of limiting the discussion. So it's more interesting if you can make people feel comfortable. Oh, that's interesting. You know, what do you think? Maybe you have a different opinion. We're interested in all those opinions. So another question that often comes up is how many participants? Well, the problem is you might invite 10 and only 5 show up. So you don't want to just invite 5 and then only 2. I've been in a focus group with 3 people. I mean, that's almost an interview. It's not almost not a focus group. So yeah, but I think, you know, between 5 to 10, depending on the topic, depending on the amount of time you have, how articulate people are, how willing they are to talk. Now, it is often said that it's a good idea to choose homogenous people within one focus group. So you might have, you know, one focus group for men and one focus group for women or something like that. The idea being that in some cultures, women or men wouldn't speak out, wouldn't feel comfortable speaking out with people from other genders being present. So that's a judgment call. Maybe you want to have a heterogeneous group so that you generate more ideas and get more discussion going. Then there's the issue of confidentiality, again, to make people feel comfortable and ensure that the participants agree not to share outside of the group what is discussed. Now, one thing that is often underestimated is that focus groups take a lot of organization to contact everybody, find a time and a place that's convenient to everybody, and prepare the setting, maybe rent a place or whatever. And it needs very skilled facilitation. You need to stay neutral and keep the group engaged all the time and respond. It's very unpredictable. So it's always a good idea to have a second researcher as a note taker to record the nonverbal and observe the process, because there's always a lot going on and you've got to be thinking, the facilitator has to be thinking, do I need to throw another question in there? And what are people saying? And then there's the dynamics. So challenges, here are some of the challenges. Ensuring participation from all members. And what do you do if participation is low? Again, how do you interpret silence? Does silence mean agreement, or does it mean disagreement or boredom? So then there is this tendency for one or a few individuals to dominate. And so you have to be prepared for that and maybe say, you know, that's very interesting. And, you know, what do you think? Addressing somebody who hasn't spoken. You want the space to be safe for airing divergent views. Otherwise, that's going to limit your data. And then there's a lot that can be learned from group psychology about how people behave in groups, and that needs to be taken into account. Okay, if somebody says something, is everybody going to feel they have to agree? Are people going to talk in stereotypes? We talked about social desirability bias. People want to present themselves in a good light. You know, and then what happens about misinformation? You have to think about beforehand how to deal with these. And then cultural variation in comfort levels of sharing and offering different opinions. In some cultures, particularly if somebody is of higher status, you would not want to express a different opinion, even if you hold a different opinion. And then there's also been quite a lot written about challenges in analyzing focus group data, because the data is quite messy. You've got a lot of things going on. People may be interrupting each other, pauses, and so on and so forth. If you record the session with consent, obviously, then your nonverbal communication is missed, but you're told that that is part of the data. That's the whole point. You do the focus group is because of the interaction. So then how do you analyze that data? It's not always easy. When you're listening to the recording, you might not know who said what. That may or may not matter. And then if you do have differences in opinion, you have to think about, well, how are you going to analyze it? Which brings us to the end of this module, and the next module will be focused on analysis. So thank you very much for your attention. And this is the end of this module. Thank you.